Hello, welcome. Thank you everyone for being on this, the first press conference of the Institutional Rescue and Recovery Coalition. So my name's FRAN TOBIN. I'm a coordinator of one of the coalition partners, the Labor Community Alliance for Community Services, which is made up of people with disabilities, seniors, frontline public employees, and poor people working on improving public services that meet human needs. So this new coalition has come together because the COVID crisis is still very much with us. So the new coalition has come together because the COVID crisis is still very much with us. For persons that live and work in congregated settings, such as nursing homes and other institutions, COVID-19 is still a life-threatening emergency. It's a disability rights issue, a civil rights issue, and a racial justice issue. This coalition is calling for more than sympathy and sorrow at the death rate. We are here to demand an emergency response to an emergency. Feeling bad while leaving people to die in institutions is unacceptable. There are solutions, and we are calling on state and local officials, led by Governor Pritzker, to rescue people from hazardous settings. It's time for emergency relocations to hotels if necessary to stem the loss of life. It's time to reduce the facility population, reduce the crowding that fuels the pandemic. If this were a fire or a flood or a hurricane, buildings and whole communities would be evacuated. So it's time to get people out. The data are undeniable. For people in congregated settings, it is still an emergency. A tiny portion of our population, roughly the size of Peoria or Elgin, accounts for more than half of all Illinois COVID deaths. You know, if half of all the deaths in Illinois were in one of those cities with a similar population, the governor would see the emergency and would mobilize money and resources and the National Guard to address it. We'd see action, not just sad faces. The data also show that these folks are not dying because they're old and sick. As a comparison, there are 30,000 people across Illinois, people with disabilities, living independently through the Home Services Program, that have the similar profile as residents of these facilities, similar underlying health issues, similar ages. But those folks are getting COVID at about 1/80th of the rate of people in those institutions. Folks left inside are dying at such high rates because they are enclosed inside institutions, the exact kind of setting that spreads infection. So it's time to get them out. Today, you're going to hear from other coalition members who are going to speak about the reality and the inherent risk for people inside these institutions. We're going to hear about racial inequities in facilities and in healthcare. We're going to hear about many residents that are eager to get out of facilities but are stuck, some of whom got stuck and then got COVID. We're going to hear about real-world models of emergency relocation that can and do work if our officials get on board. So I will bring up our speakers. We'll post the names in the chat to make sure folks have proper names and spellings. And so I'm going to start with calling up Lindsay Sullivan, a facility resident and officer of ADAPT Chicago.
Hi, my name is Lindsay Sullivan and I'm 35 years old. I have been living in nursing facilities for over 7 years. I can say this much about the pandemic. It's been hell. We can't go outside. We can't go outside, let me say, for more than 15-minute intervals for the last 4 months. My roommate and I have essentially barricaded ourselves in our room because 13 people are reported to have been infected, and trying to not to let people into our room, but that's impossible because we can't completely isolate ourselves. We're always in close proximity to other residents and staff. There's a small group of us that try and help each other remain positive, but recently my boyfriend Ernest left the facility because he just couldn't be locked in anymore. And now we even can't see each other. It's heart-wrenching and difficult to stand by as people get sick. And I feel like we're being left behind and treated like we don't matter. I don't think people realize how heartbreaking it is if you're in the facility, you can't get to your loved ones. It's devastating to you and your loved ones. And now because of this virus, my mental health has been breaking down, but it's being written off as a casualty of this illness. I feel so weak because I have not been doing very much physical activity. And furthermore, I was preparing to move into the community, but I was put on hold because of the pandemic. I'm now progressing towards moving out, but now it's towards the end of August. Thank you.
Thanks, Lindsay. As you're speaking, a couple questions come to mind. First, I mean, in the last 3 months during this crisis, has there been a day when you felt really safe inside the facility?
No, because we don't know who has COVID. If someone does have it, you know, if we are around that person, if we can get it, because for most of this time, we didn't even have PPE.
And if you were to be relocated to a hotel room or something similar, you know, what would you need in order to live there and stay healthy?
The only thing, even as going forward to the community, I only require a PA. And actually, the facility has been preventing me from going to essential medical appointments since the pandemic started. So they're actually putting my health in danger by preventing me from going to appointments like for my diabetes and for wound care. So, you know, this is actually furthering my need for the facility.
Right. And you said you're actively working to get relocated. From talking to other folks in your facility, what percentage do you think of folks who are there would rather be relocated to a hotel room or something similar?
I think at this point, almost everyone would rather be in somewhere different. And I think you know, I don't think the requirements, you know, there's no one here that couldn't be relocated.
Gotcha. All right, thanks, Lindsay. So next up, we're gonna call up Anita Cameron from Not Dead Yet and speak about some of the racial inequities.
Good afternoon. My name is Anita Cameron. I am Director of Minority Outreach at Not Dead Yet, a national disability rights organization opposed to doctor-assisted suicide and euthanasia of disabled people. Racial disparities in healthcare is one manifestation of systemic institutional racism. Blacks and Latinos in particular have been disproportionately affected by COVID-19 across the country, across all age groups and socioeconomic statuses. We get infected and die at 2 to 3 times the rate of white Americans. Now add ableism to this picture. The lives of disabled people are too often devalued. We are seen as having little to no quality of life. In this country, the bodies of Black and brown disabled people are disposable. We need look no further than the case of Michael Hickson, a 46-year-old Black man from Texas. Mr. Hickson was a quadriplegic, the result of a brain injury caused by a heart attack. He was placed in a nursing home where he contracted COVID-19. However, due to his disability, the doctor decided not to treat him, stating that he had no quality of life. He was placed in hospice and allowed to die. Mr. Hickson's case is only the tip of the iceberg. Many of us disabled, particularly us Black and Brown disabled, live in fear that we will share Mr. Hickson's fate should we find ourselves in hospital with COVID-19. And Michael Hickson is an example of what happens to many in nursing homes. It's why Not Dead Yet has joined over 40 disability organizations to demand emergency relocation. Thank you.
All right, thank you much, Anita. Next up, we're going to ask for an experience again from another person with direct lived experience in institutions, Suzanne Klug, who is a member of the Jane Addams Senior Caucus.
Okay, my name is Suzanne Klug. I'm a member of the Jane Addams Senior Caucus organization, which fights for economic, social, and racial senior justice. We believe that all people, regardless of income, should be able to stay in their communities and age in place if they choose to. I lived in 3 different nursing homes in Illinois, the last one for over 1.5 years. I got out January 13th, just in time not to catch the virus. I got out with the help of the Colbert program, which helps people transition from nursing homes. But it took a year to get out, which is too long to be kept in captivity, especially for people who can take care of themselves as I was able to do. I shared a room with 2 other people, which makes it impossible to socially distance. One of my roommates, Charlotte, was 99 years old. She was eagerly looking forward to a visit from one of her sons who lives in Canada and promised to be there for her 100th birthday. Sarah was only 38, and she was the one the other residents turned to when they had a problem. Wayne kept us all laughing with his sense of humor and cheerful smile. Maria was one of my roommates and found a way to cheat at bingo. I will miss her spirit. Christy was my best buddy, and we used to sneak into the kitchen together, trying not to laugh, and steal food and pass it out to the other residents. All 5 of them died on the same day from the virus. If I hadn't gotten out when I did, I could have joined them. These people aren't just statistics in a TV COVID update. They are human beings. They had names. They had lives. I spoke to the nursing supervisor there a few days ago, and she said she felt like she was working in a death camp. Where is the outrage over these deaths? The virus has been around for months. The urgency of the situation is being ignored by the people who could save thousands of lives. What is Pritzker waiting for? More deaths? He needs to issue at least a partial evacuation order from congregate settings, and it needs to be done now.
In the last 3 months, did you feel safe? Was there any day that you really felt safe when you were inside?
When I was in the facility, let's see, I'm going back to January. Well, I used to not feel safe because they refused to lock the door leading outside at night. But that was the only reason. And I didn't feel safe because one of my bathroom mates, I should say, shared a bathroom with her, contracted a disease, and I can't remember the name of it. It's a common disease you can get from being in the hospital. And they didn't tell us about it. She was highly contagious. They taped the bathroom door shut so nobody could use it, so we wouldn't share a bathroom with her. So no, I didn't feel safe. I didn't feel safe living there because they withheld information, important information from us.
Right. And so from your experience and talking to other residents in those facilities, how many of those do you think would want to be relocated if they had the opportunity?
I think all of them would want to be relocated if they had the opportunity.
Mm-hmm. Great. Especially
Especially now, but you know, the longer we wait, it gets to be too late. It's already too late for a lot of people. Welcome.
This person is Esther Sanders, who is involved and works for the Progress Center for Independent Living and has been working actively in helping people transition.
Good afternoon. My name is Esther Sanders. I work for Progress Center for Independent Living. Progress Center is a disability rights and service organization that serves Suburban Cook County In my role as transition coordinator with Progress Center, I assist people with disabilities who want to transition out of nursing homes into their own apartments or into places where they are more independent. My colleague and I together maintain a caseload of from 7 to 10 people at one time who are in nursing homes and who want to move out to independent living. One of the highlights of my job with Progress Center is the moment when I make first contact with the consumer. When they learn about the community integration program, people are typically so excited to enroll in a program that will give them more independence, a program that will give them an opportunity to live in a place where they make choices for themselves instead of having someone dictating their decisions. Since COVID-19 and since the shelter in place and stay-at-home orders have been implemented in Illinois, the roadblocks to independence for people living in nursing homes have increased. The health threats to nursing home residents have also increased. I can say the threat to nursing home residents is greater than for other people. Based upon reports, institutional residents make up more than 40% of COVID-19 deaths in Illinois. While the threat rises, nursing homes cut off vital social connections, family not allowed to visit, advocates, ombudsmen not allowed to visit, and that makes the situation worse. They are more vulnerable in the nursing homes because there's no checking point. Two of the consumers whom my colleague and I are working on contracted COVID-19 at 2 different nursing homes. Thank God both of them recovered. Here's one case to note. This person with disability was ready to move out of the nursing home, but the discharge was delayed due to the pandemic. Then he got COVID-19, although he later recovered. Through the advocacy of Progress Center, this consumer was finally released from the nursing home and is currently living in an apartment. While the nursing homes may be cutting off social contact in the name of safety, I find myself with these 3 questions. Why, in the name of safety, is more not done to protect people in nursing homes with protective gear? Why is more not done to transition people out of nursing homes into more isolated settings where the risk would be not as great? What intervention can be used to minimize the delay tactics and blocking of transition process by some nursing homes? Unfortunately, even before COVID-19, the process of transitioning out of nursing homes was at best very challenging. Though Illinois is mandated to transition people out of institutions under 3 consent decrees, there seem to be obstacles at every turn, such as oftentimes the person who is being discharged is to go through approval just because they are disabled. The approval process, as if Illinois still has not learned that anybody with any type of disability can be successful in community with the appropriate services and supports. The wait for available, affordable, and accessible housing sometimes take months, if not longer. And perhaps the most disappointing, rather than working with the nursing home to meet the needs and wishes of the resident, we often have to work without the support of some nursing home staff. I feel blessed though that I have a consumer at a nursing home, which I call a beautiful nursing home, because this individual is a social worker who is very supportive. She will do all she can to facilitate the process. Sadly though, while a supportive social worker should be the rule, it is not common. Yet the victim of all this bureaucracy at the end of the day is the consumer. Governor Pritzker and the state of Illinois have an opportunity now to intervene and mandate that people in nursing homes and other institutions evacuate the dangerous situations they are living in and transition into places in the community where they will be safer, happier, and more independent. There are plenty of agencies like Progress Center ready to work with the state to see this happen. There are also other examples of places in the United States where this is now being done. We urge Illinois to follow the example of others, utilize existing housing, utilize existing resources, and most importantly, listen to people in institutions who want out. Thank you.
A question, just you've transitioned, and folks from Progress Center and other stills have transitioned a lot of people. How many of those out of nursing facilities, how many of those folks require specialized medical equipment or extra care, or are they able to manage to live outside of the facilities with minimal support like a PA?
Okay, my experience with Progress Center, we have one who needs some specialized, but not too much. They only need the supports like a homemaker or PA to be assisting them, and they will be able to do everything that everyone else does.
Got it. Okay, that's really helpful to know. Thank you so much for all that and for all you're doing. So our next person, next speaker is going to be Tony Primer. And
Hi, my name I've been in, and this is my third nursing home in the last 3 months. I'm a father of kids. My youngest one is 5 years old. It's been really excruciating for her because she don't understand what's going on right now. The nursing home that I'm currently in, it has over 75 cases of COVID inside. And right now, they don't practice social distancing. Like I said, this is my third nursing home in 3 months. I keep getting bounced around because they don't want the nursing home that I was at kicked me out and put me in a psych ward because I was opinionated. They don't want people there. They want people there that they control like cattle. Instead of dealing with people that have their own mind and putting people in places that's safe, they'd rather put you in a psych ward and not deal with people that want to transition to safe housing.
thanks for that, sharing that experience in multiple settings. I mean, it's the same kind of questions that keep coming up. Over the past couple months in this pandemic, have you felt safe when you're inside the facility? Do you feel like you're safe and secure?
No, not at all. Especially when they keep moving you around, exposing you to this COVID.
Mm-hmm.
It's safe at all.
Right. So despite the pandemic, they were willing to move you into multiple places. So if you were relocated to a hotel or an apartment today, what kind of supports would you need in order to stay healthy?
A PA and Hoyer lift.
Mm-hmm. So, but not specialized medical equipment or anything like that.
For sure, because I can take care of myself, everything else wise.
Right. Gotcha. So from talking to other folks in your facilities where you've been, what would you estimate is the percentage? How many of those folks would rather get out if they had the chance?
Everyone will want to get out.
Mm-hmm. All right. Well, again, Tony, thanks so much for being willing to speak and share your experience with folks. And as a reminder, we'll have questions from media after the speakers are finished. We have 2 more. So next up, we're going to ask for 2 people who have had a lot more of experience in the actual day-to-day moving people around and designing programs around relocations. So first up, we're going to ask MISTY DION to speak, who is part of the Roads to Freedom Center for Independent Living. MISTY?
Like Fran said, my name is MISTY DION, and I'm the CEO with the Roads to Freedom Center for Independent Living. And much like ESTHER, we've been transitioning people from nursing homes for decades successfully, and experienced many of the same barriers and obstacles that ESTHER explained. Most frustrating experiencing them during this pandemic when we watched the many of our loved ones dying in place, if you will, and the state and our local disaster response emergency management units not dispatching to help was very frustrating, and of course what prompted us to create the program that we have, which is a disaster relief and relocation program, where we are doing much of what is spoken of here, where we are getting in touch with the individuals who are still locked in the nursing facility without any family or supports, and we are transitioning them or relocating them into in some cases hospitals first, and then nursing out of the nursing facility into the hospital and into a hotel. In many cases, right from the nursing facility into the hotel or into their own home under our relocation program. We're utilizing the therapeutic leave with the nursing facilities and fighting for, unfortunately, even in those situations, the facilities are invoicing residents and using scare tactics to stop them from moving out. But we've been successful. We are doing it. Many people are only in need of live-in caregivers or attendants. In some cases, we've gotten skilled nursing or specialized services, but the majority of our folks are only in need of an attendant. And this gives them a chance to socially isolate and essentially save themselves from contracting the virus.
Our last speaker is going to be Marcy Roth from the World Institute on Disability, who will have more of the bigger picture of things that have been happening and experiences globally, and in particular with people have been talking about disaster relief, and we would consider this a disaster and calling for emergency response.
Hi, my name is Marcy Roth, and I am the Executive Director and Chief Executive Officer of the World Institute on Disability. WID is the first, one of the first global disability rights organizations founded by and led by people with disabilities. We stand in coalition with all of these organizations and organizations across the country, demanding that people with disabilities be immediately relocated out of congregate facilities and into safe housing in the community. There are at least 50,000 people with disabilities who have died in congregate facilities in the last 125 days. 50,000 people with disabilities. Many are Black, brown, multiply marginalized. Virtually every one of the people in a nursing home or congregate facility is a person with a disability and civil rights protections. No one goes to a nursing home because they are old, only because they have a disability and weren't provided with adequate support to remain in the community. The Department of Justice has repeatedly reiterated that there are no waivers or suspensions of the rights of people with disabilities to live in the community. There are no waivers for disasters or emergencies. The Olmstead decision, Supreme Court decision 21 years ago, solidified the Americans with Disabilities Act and the right of people with disabilities to live in the most integrated setting appropriate to their needs, which certainly is not a congregate setting where people are dying by the tens of thousands. I served as the disability lead for the Federal Emergency Management Agency, FEMA, for almost 8 years. And I am very familiar with the federal government's obligations and resources. My organization, WID, the Partnership for Inclusive Disaster Strategies, and organizations across the country have been calling for the use of emergency and disaster federal funds to be immediately used to relocate people with disabilities to save their lives. This is an emergency of unprecedented magnitude, and we have got to stop the killing of tens of thousands of people with disabilities. And we can do it. The resources from the federal government can be used. We have organizations from across the country who are already transitioning folks, and many, many organizations standing ready to get people out and get them to safety. Thank you.
So I know this is when we want to open up questions to representatives of the media. And our hope is to start by, if folks can post your questions in the chat. So one question asked is, are we asking to completely empty all of the facilities? And the answer is that's not what this campaign, this coalition is demanding. We want to reduce the population in these facilities so that two things happen. One is that folks who are significantly at risk are removed from that more dangerous setting and put in safer settings like hotel rooms on an emergency basis. But that also reduces the population inside the facility, and they should be at least down to one person per room. So that way each person in that room has the possibility of at least having some social distancing in order to reduce the spread of the virus. That makes both the residents that remain and people who work in those facilities safer.
Just to add to that point, we are asking for people to have choice. Residents locked in these facilities have not been given choice to socially distance or to isolate. That's what we're asking for.
Also, to add to that, we are, like I'm going to say, stuck in rooms that have 2 to 4 people in them. There's no way to isolate when you have 2 to 4 people to a room, and when you're told that you need to self-isolate because, you know, you might have a cold or symptoms that you might think are COVID symptoms, you can't self-isolate from your roommate who's less than 10 feet away from you, and you share a bathroom, and there's only 2 showers on the whole floor. So there's no way to distance yourself from anyone.
I have a question. This is about, I wanted to say that I lived in a institution years ago, and when you talk about, I agree with everyone here, when you live in a congregate setting like a nursing home, you do have a roommate and stuff like that. So when you have that, it's hard to isolate yourself when you're sick or something. And I was lucky enough to move into a group home, but even that is hard not to catch something. So so I'm all for people being safe and moving out of institutions and out of segregated settings, and I would really assure their safety when they're there. And also, our president is saying that there's nothing here, but obviously there is something here, because we're talking about the thousands.
Si alguien necesita traducción en español, también hay alguien que habla español.
Great, Chewy, thank you.
I just want to make a comment.
Michael, jump in. This is Michael Grice speaking.
It might take 2 weeks before you see a so-called doctor in a nursing home. You can tell staff that you're sick, but it might take a week or two before they actually get a hold of the physician.
Michael, for those of you who don't know, had been in institutions for quite a while and has been living independently since then, and been very involved in a lot of these struggles, including being co-coordinator of Chicago Adapt for a while. All right, so if there are, we probably need to wrap up. First, thanks again for all of our speakers. Thanks again for everyone from the media who are coming in. We want to, again, folks in the media who want to follow up, feel free to contact us. We can do follow up, and there will definitely be more to come on this issue. So the Institutional Rescue and Recovery Coalition is growing, and we will be back in touch.